Now, prostate cancer is once again at the forefront of public conversation. This after former U.S. President Joe Biden's diagnosis with an aggressive metastasized form of the disease. Now, how can Filipino men better prepare for this condition, and what signs could they watch out for? And now joining us in the studio is internal medicine specialist, Dr. Edzel Magtoto. It's a beautiful day, Doc Edzel. Good morning.
Good morning, everyone. It's a beautiful day. It's so nice to be here, finally live.
Yes.
Now, Doc, just to start it off, now what are the common and early symptoms among men with regards to prostate cancer?
Okay, so first and foremost, for those who are watching, so prostate gland is actually a secondary sexual organ only found among men. And what it does is it actually gives nourishment to our semen or the seminal fluid of men. So initially, they at the younger age, the size of a prostate gland is usually of a pea size. And when men reaches at the age of 40, it actually grows. All right, and eventually certain risk factors could happen. So what are the common and early signs and symptoms that we need to watch out for men who are prone or at risk for having prostate cancer? So first, it could actually mask any types of prostate problems. So it could be because of an infection or what we call as prostatic hyperplasia or an enlargement of the size of prostate gland. And the other one is prostate cancer. So it could mask these types of problem. So signs and symptoms could be frequent urination at night. We call it nocturia. So when a patient tells us that they wake up in the at night, usually 3 to 5 times with disturbed sleeping pattern, that's actually something to watch out for. Other symptoms would include pain during urination, which shouldn't be a problem at all, and pain during ejaculation. So patients would tell us that they have painful erection. That's something to look out for and watch out for. And of course, if you have hematuria or gross blood in your urine and even in your semen, is something to be mindful about, which could be a symptom of an aggressive form of prostate cancer. And lastly, could be bone pain, pain, pelvis pain. But all of these signs and symptoms I've mentioned could actually mask either of an infection, of a prostate hyperplasia, and prostate cancer. That is the reason why we really recommend men, especially at an early age of 40, to undergo screening for early detection.
Now that you mentioned that, Doc, how important is early detection, and what happens in the progression of this cancer if the symptoms are left undiagnosed or untreated?
Okay, so prostate cancer is the third leading cause of cancer among men. So based on statistics, 1 out of 9 men could actually be diagnosed with prostate CA. But what's the good thing about prostate cancer is that it's a slow-growing cancer, meaning to say if it's detected at an early stage, there is a high chance or good prognosis for patients. So stage 1 or 2 could have at least 97%, based on books, 97% good prognosis, or you could be treated from prostate cancer. However, if left untreated or undiagnosed, in the next 5-year survival rate, only 30 to 40% would actually eventually survive from it.
Okay. Doc, what are the risk factors, for Filipino men developing an aggressive form of prostate cancer? Because in the news, we are seeing U.S. President Joe Biden. He was diagnosed with a different form of prostate cancer, an aggressive form of prostate cancer. So what are the risk factors for Filipino men developing this
So
sickness?
Sadly, lalaki, that's the first risk factor. So any man could actually suffer from prostate cancer. There's no exemption, especially like Joe Biden himself acquired it. Second of all, could be genetic predisposition. So if you have a family member or relative who suffered or succumbed from prostate cancer, then there's a really high chance of getting prostate C. According to studies, 10% of acquiring, like 10% increase if your dad suffered from prostate cancer, or among your maternal side, there's a 5% increased chance. Aside from family and genetic predisposition, nowadays it's very advanced. You could do gene karyotyping. So if you have BRCA1 and BRCA2 that is present in your body, then you have a greater chance of acquiring such disease. based on other studies, ethnicity groups. So black men, African American descent are most likely to acquire or have a significant risk of acquiring prostate CA. But now we have what we call like lifestyle factors. So obesity could be one. So people who are overweight could suffer from prostate CA or at risk rather because of high fat intake, hormonal imbalances and metabolic changes. Sedentary lifestyle, alcohol consumption is another factor that we have to consider. There is a close relation, according to the recent studies, smoking as well, and what do you call like the exposure to chemicals as well.
Yes.
Okay.
And we both know, like going back to Joe Biden, so he's right in his 80s, and given the factors of prostate cancer development, how does age specifically factor in both, not just the diagnosis, but also the prognosis of prostate cancer, especially for men in their 70s and their 80s?
Okay, so based on research, men at the age of 60 have 65% risk of acquiring prostate CA. And according to books, at the age of 70 to 80, men have 1% of existing prostate cancer cell in their body.
Oh,
yes.
wow.
So with regards to Joe Biden's case, this is quite very alarming because prostate cancer is actually very detectable and manageable. So we're quite surprised that he got it at a later stage. So based on the news, he's of a Gleason score 9. So it's a histopathologic grading system. So how do they do it? So they do prostate biopsy. So just for the sake of our audience, so score of 9, how do they got it? So 2 tissue samples were taken. So a grade of 1 is well differentiated, meaning it's close to the natural looking prostate tissue, and then they sum it up. So the more morbid looking is 5. So Biden surely had a 4 and a 5. That gave him a 9, which is a high grade kind of prostate cancer. So, and now that it has metastasized to his bones, so there are different treatment options that later on we could discuss for his case.
Doc, if you mentioned if there's family history of prostate cancer in the family, how often and at what age do we need to have checkups? Does it have to be every year or every 6 months?
So ngayon talagang iba na yung panahon natin, no? So it's very important that we actually go on for consultations and checkups. But for prostate cancer alone, so we highly recommend people, or especially men at age 50 to 55, to undergo screening. So there are several tests that they could undergo, no? Like DRE, digital rectal examination, that is being done by specialists like myself. So if we palpated prostate, especially the peripheral zone, that's where the, kasi parang round yun, no? So if we palpated something like glandular and hardened and it's enlarged, then we could suspect that patient might be suffering from at least prostate CA or prostate enlargement. We do PSA, or prostate-specific antigen. It's blood serum taken for the patient. So it is prostate-specific antigen, but not prostate cancer-specific. So there is could be a false positive or a false negative also. No, could be elevated at times, especially if the patient has infection or prostatitis. Other things, we have imaging. You can do ultrasound of transrectal ultrasound for men. It's non-invasive. It's very simple. Patient just lie down on the bed, and then we can see an enlargement. And of course, biopsy, that's the last one warranted for the patient. As I've mentioned, there's a histopathologic grading for that.
Out of all those, Doc, which one is the best? I've done the PSA. So you said sometimes you could have a positive, negative, or something like that, that it can't really be detected 100%. Which is the best kind of checkup we can go to that you say it's not invasive?
So ideally, we really rely sometimes on the PSA. You know? So there's a value or a cutoff value. So more than 4 is considered abnormal. Especially we consider the age of the patient. Then we do at least an imaging. So biopsy, an ultrasound rather, a CT or an MRI. MRI is the gold standard of imaging that we could do. And then if there's really a need to do so, we proceed with biopsy. It is the one that we can consider most specific in diagnosing prostate cancer.
Doc, you've mentioned now different kinds of tests that people can take to see if they do have prostate cancer. Let's talk about treatment and therapy. Are there any new advancements in terms of treating this sickness, this disease?
Yes, maswerte kahit papano, no, that there are a lot of treatment options available, readily available, especially now in the Philippines. No, we have advanced medical system and facilities already, as I could say. So we go with surgery at first, no. So actually, una muna active surveillance, no. We call it watchful waiting. So lo and behold, if the patient is diagnosed at the earlier stage 1, 2, we could do active surveillance. So we just ask the patient to go consultation regularly. We monitor the enlargement of the prostate cancer, the symptoms. If there's obstruction or blockage in the urine, then that's the time we commit with surgery. Okay? So surgery, we can do radical prostatectomy. We remove the entire prostate para wala ng source of cancer cells. No? Other thing, aside from radical prostatectomy, we have laparoscopic, minimally invasive surgery nowadays. And then we also have robotic surgery, no? Robotic prostatectomy, kung saan mas fine yung pagkakagawa, no? Nowadays. Aside from surgery, we have hormonal therapies, no? And this one, according to the doctors of Joe Biden, this is what is expected of him to be receiving in the next few weeks. So hormonal therapy, so anong ginagawa nito? So we do injections, we give injections to the patients. Why? We give androgen deprivation. Kasi yung testosterone, yun yung nag-fuel eh. So imagine, if there's a production of testosterone in the body, it adds fuel. So mas lalong nabubuhay yung cancer cells. So we do the opposite to that. So we inject. Although it's quite expensive, when I did the research recently, it's 2,300 USD, so 120 per month for the patient. So aside from hormonal therapy, we have radiation. No? So we have external radiation. So they target the main mass or yung bukol. And we also have internal radiation or the brachytherapy, wherein they put a seed inside. No? It could stay in the body of the patient. That's what your dad had. And so on. But now we have immunotherapy, targeted therapy. So it's very specific. Kung ano yung cancer tissue type, yun yung tina-target niya, and they just take it orally. So there are a lot of treatment options readily available so far.
Doc, just for our audience, though, what's the function of a prostate?
Okay, so prostate, yun, gaya ng sabi ko, it's a secondary sexual organ, no? So it gives nourishment, pagkain ang binibigay niya sa similya ng lalaki. Oo. So ang wrong notion, pag tinanggal ang prostate, hindi na makakapag-ejaculate or magkakaroon na ng erectile dysfunction. The truth is hindi. No? The truth is hindi. It's the testis and the seminal vesicles that gives out the fluid itself. The prostate gives the nourishment or the food to the seminal fluid.
This is such an interesting conversation. I wish we had more time.
A lot of
Doc.
information.
Yes,
Yeah.
But if our viewers would like to ask you more questions or maybe schedule a checkup with you, Doc, where can they reach you?
Well, you can find me on my Instagram. It's dr.z. You can also find me on my Facebook page. It's Dr. Edzel Magtoto. You can find me at the Medical City in Clark and also in Green City in San Fernando, Pampanga. But I also have a clinic here in BGC located nearby St. Luke's Medical Center. There's a lot more that we want to help, but thank you for this avenue, for allowing awareness, especially that Prostate Cancer Awareness Month is happening next month.
Before we end, you said next month there's Prostate Awareness Month.
Yes.
A lot of events or awareness campaigns happening?
Well, the Philippine Urological Association has been doing free screening tests, so hopefully you could check out their pages on Facebook para yung mga elderly men natin could go testing.
Okay, thank you very much, Doc. A lot of information,
Thank you
learning,
so
especially
much.
for us men. Thank you for joining us, Dr. Edzel Magtoto.